Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. Today you're going to talk about issues that affect millions of children worldwide. Pediatric heart health. Heart health remains the leading cause of death globally. And while it's often associated with adults, children can also be affected by various heart conditions. My guest today is Dr. Elizabeth Mitchell, a pediatric cardiologist with Cohen Children's Medical Center at Northwell Health. Dr. Mitchell, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you so much for having me.
It's a pleasure to have you. What does a pediatric cardiologist do? And what age group do you treat?
So we look at really any children from the age of birth up to the age of 18 to 20 who have any cardiac-related issues. Probably the majority of what we see is children with congenital heart defects, which sometimes we actually do diagnose prenatally as well. Part of my area of practice is also doing fetal echocardiograms, where we just specifically look at the heart of the fetus to determine if there's any abnormalities. So we really see a wide range of patients from fetal life to the 20s.
So tell us about your journey. What made you want to become a pediatric cardiologist?
I was actually always interested in the heart. First and foremost, I thought that I was going to be an adult cardiologist, but I just found that I enjoyed working with children so much more, and the heart conditions that children deal with are much different than what adults deal with. And actually, the two fields of pediatric cardiology and adult cardiology are very different. When children with congenital heart defects grow up and become adults, there's this whole new field of pediatric cardiology called adult congenital, because adults cardiologists don't know how to deal with the pediatric related congenital heart defects, and I certainly don't know how to deal with adult related heart defects and heart problems. So they're two very, very different fields.
What is the most prevalent cardiac issue you deal with for mothers who are expecting their children?
Yeah, so for pregnant women, when we do fetal echocardiograms, most of the time it's a concern that they either have a condition or something else puts the fetus at higher risk for congenital heart disease, such as uncontrolled diabetes or a strong family history of congenital heart disease. Those are some of the most common reasons for patients to get referred. And we do an evaluation of the baby's heart to really look for any major structural heart defects. Obviously, given that the baby is still just a very small fetus, we can't rule everything out, but we can rule out the major defects, and we can also, if need be, follow up after the baby's born to do further studies, like an echocardiogram, to take a look at the heart.
So how widespread are heart problems among the younger population?
Luckily, they're still pretty rare. And an analogy that I give to a lot of my patients is that if you were to ask all of your friends and relatives if they know if any of them have a child with a congenital heart defect, maybe there'd be one in your extended group of family and friends, but more so it would be somebody who knew somebody who knew somebody else. So it is still quite rare, which is good. And the claim is that there's about a 1% chance of congenital heart disease in the entire population, but that also includes very minor things that don't really require follow-up or require any sort of intervention. So luckily, things are still quite rare.
So the diagnostic procedure that's usually used, is it an echocardiogram?
Yep, that's a ultrasound of the heart.
Right.
The other thing we do is an EKG, which is the electrocardiogram. That's when we put a lot of stickers on the chest and we get an electrical tracing of the conduction of the heart. That EKG looks at how the electricity goes through the heart and helps the heart conduct and beat. The echocardiogram is an ultrasound. And then there's the standard, what many cardiologists would say is the gold standard for evaluation, which is listening with our stethoscope.
Yes.
And that's listening to the heart.
Can't beat that good physical exam. So,
exactly.
When you're talking about one of the main findings, I don't know how prevalent is heart murmur. Is that very prevalent? Heart
murmurs are actually quite even more prevalent than congenital heart disease. There are a lot of babies and children who have heart murmurs that can be innocent heart murmurs. Actually, a heart murmur is just an extra sound that we hear when listening to the heart with our stethoscope. And I think a lot of people, we all hear the term heart murmur and we think it has a bad connotation. It has a negative connotation. Right. And we think that a heart murmur is a heart problem. But especially in pediatrics, that's not the case. There's lots of what we call innocent heart murmurs, which means that the heart is completely normal. We just happen to hear a sound when we listen with our stethoscope. And
so they're still functional and they're still able to have,
exactly.
It's a functional murmur. So
exactly.
There's no real, yes. So
a child with an innocent heart murmur is something I tell to parents all the time. The child with an innocent heart murmur does not have a heart problem or a heart condition.
So is it? Yeah. So is it
even if I explain that the heart is normal? People still walk away with the thought that this is a heart problem, but it's really not. It's just something that we find on exam that really has no impact or has any sort of impact on the heart or any problems with the heart. So if you're ever told that you had a heart murmur, you may not have a heart condition.
Right. So is it necessary to put it in your health history if you're filling out your health history form for possibly a physical or a job, or is it necessary to even put it down?
I think it would be necessary to put it down. And I think it's good. I tell my patients all the time, I want you to know about your health and be an advocate for yourself. But it is important to know if you have a heart murmur, is it an innocent heart murmur, which means that you don't have any heart issues, or is it related to something else that is a heart issue that requires follow-up? I think putting the term heart murmur on a form isn't necessarily helpful unless you know whether it's an innocent heart murmur versus something related to a heart condition. But it's still important to bring up. And I try and teach all of my patients about what the heart murmur is and if they do have a heart condition, what their heart condition is. And if they don't have a heart condition and they have just an innocent heart murmur, it's especially important to make them realize that it's an innocent heart murmur, which means that there's no cardiac abnormalities.
Are there any other common heart issues that you treat? I know you're a pediatric cardiologist. So what are some of the other names, illnesses, or disorders you treat?
So one of the other common conditions is an arrhythmia or an abnormal heart rhythm. And I will say that that's not my area of expertise. I have colleagues within pediatric cardiology that specifically take care of heart arrhythmias, and that's usually treated with a medicine, sometimes with a procedure. Another thing that I take care of is something called cardiomyopathies, or an abnormality of the heart muscle. And sometimes that can be in the form of the heart being too dilated. Sometimes the heart is too thick. But in all these conditions, there's an abnormality with the pumping function of the heart to the point where we have to monitor the child very closely, do echocardiograms a few times a year, be on the lookout for symptoms that might tell us that the heart isn't functioning well enough, and consider medicines to help the heart pump better.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about pediatric heart health with my guest, Dr. Elizabeth Mitchell, a pediatric cardiologist with Cohen Children's Medical Center at Northwell Health. So, Dr. Mitchell, one of the questions that came up is, I know that there's a lot of obesity. Obesity is very prevalent now.
Sure.
Have you seen a lot of cardiology issues as it does connect to obesity? And what have they been?
So we haven't seen those things in pediatric cardiology so far, but what we do know is that the heart disease that happens in adulthood, we're seeing early signs of that in children who have obesity. They're kind of somewhat rare tests, and they're tests that are not frequently done and more done for research purposes, but there are tests that can look at the large arteries, large arteries and tell if there's any early deposition of cholesterol or any other deposits into the arteries that would increase the risk of heart disease when they become an adult. So we know that they are related, but we just don't happen to see those effects on the children during childhood. But we know that it's causing the problems as adults to happen faster.
Is there any disorder or disease process that you see in a child that you really want to pass to their adult practitioner and say, watch this particular condition issue with this patient because this is possibly going to progress?
The most times where we're in that situation where, when a child becomes a young adult and it's time to pass the torch on to their adult specialists, the most common situation that we come across is if a child either has a congenital heart disease or a cardiomyopathy or an arrhythmia, and that the care of that needs to continue. Because the children with obesity and other health-related issues like hypertension and high cholesterol, those aren't, because we don't see the manifestations of those things in childhood, we're usually not following those children. But it's more that we just know that those issues are happening faster in those children and that they are at higher risk.
Doctor, how did COVID impact children, in particular as it relates to their heart?
Yeah. So COVID didn't impact children in the same way it did with adults. But we did see children who were hospitalized for, say, a COVID infection who had a very serious illness related to the COVID infection. But the other thing that we saw was a condition called MIS-C, or multisystem inflammatory syndrome in children. Mm-hmm. And this is a condition that occurred about 3 to 5 weeks after a COVID infection, where the body would have a significant inflammatory response resulting in multi-organ dysfunction. And the heart was very frequently, if not all the time, impacted in this condition, causing the pumping function of the heart to decrease. It caused the heart valves to leak more than typical. Sometimes there was a fluid collection around the heart. But most importantly, there was decreased pumping function of the heart. What was, I guess, a silver lining of this condition, MIS-C, is that with treatment, those heart-related issues resolved very quickly. And as we found now, years after first discovering this entity, this was really first all discovered 3 years ago. But all of our patients that we follow up with very closely in the cardiology clinic are all doing very well and have, complete resolution of their heart function, which is fantastic.
So in the past year, particularly in fall of 2022, we saw a very high amount of viral infections in children,
yes,
particularly flu, yep, RSV. How do these impact children's hearts?
Yes,
if at all.
It was a very bad fall. I will say that. It was the first time in my career that I ever heard from our hospital administration to say just how bad things were and how much, additional help was needed, because the ERs and the urgent cares were completely overwhelmed. To say that they were overwhelmed is an understatement. But especially the flu and RSV are two viruses that we do see cardiac complications from. The flu can cause the heart function to become decreased, and there can be rare cases of myocarditis associated with influenza. But RSV is one that we are even more concerned about, especially for children who have cardiac defects. So babies, especially under the age of 2, if they have a cardiac defect, they're actually eligible to get a specific treatment called Synagis, and that helps prevent or at least lessen the severity of an RSV illness. because we know that in babies and small children with a severe congenital heart defect, they have much worse outcomes with RSV infections. We know that especially in infants, the rate of death is much higher in children with congenital heart defects. And on a side note, also infants that had a history of premature birth. So RSV is definitely something that was very scary to us, and we were vigilant about making sure that all of our children who are at risk got Synagis or I'm blanking on the generic term for it, but we made sure that they got their Synagis because we did not want them getting RSV. We knew that outcomes would be much, much worse for our children with congenital heart defects.
Yes, doctor. So how do you, I know you treat a very young population, how do you make them feel comfortable during their treatment when they come into your office?
Yeah, it's hard because they, especially children who have been to the hospital a lot or have other medical conditions, they do not want to be coming to see doctors, and I completely understand that. But I think that first and foremost, your whole staff having a group of people that are good with children and that understand the need to make them feel more comfortable is really important, from the MOAs to the nurses to the echo technicians and obviously the doctors to do whatever you can do, both in how you speak to them and how you work with them to make them feel as comfortable as possible.
Well, how does lifestyle changing or modification play into this pediatric cardiologist role with treatment of heart conditions? Do you incorporate the family? Is this something that you really talk to?
I try and start early in childhood with the families and the children at emphasizing the importance of healthy eating habits. A lot of the unhealthy eating habits are things that will result in cardiac disease much later in life. But I always emphasize with them that you already have a heart issue. You don't need another one. You don't need something else on top of what you're already dealing with. And really, one thing I really emphasize with my patients, small patients, but also teenagers, is to be an advocate for yourself. And part of the way that you can be an advocate for yourself is to not only know about your heart conditions, know about what kind of follow-up is needed, know what kind of medicines you need to take, if any, but also know to take care of yourself and to keep your heart as healthy as possible, because your heart is already dealing with one condition.
You work in a hospital, am I correct? Northwell?
Yes, both in a hospital and in a clinic, seeing patients in the outpatient world and also seeing patients in the hospital.
So is it a collaborative team where you work with, I know you're a pediatric cardiologist, do you work with other specialties? Yeah,
we have a lot of collaboration. The first that I can think of is in our pediatric cardiac ICU. We have between our cardiothoracic surgeons and our pediatric ICU team and our pediatric cardiologists, we all work very closely together, taking care of patients before and after heart surgery. The anesthesiologists are highly involved as well. And in addition, kind of outside of those children who are getting heart surgeries, we also follow a lot of children who have other medical conditions that put their heart at risk, such as, children who have cancer. Some of the chemotherapies can put their heart at risk for cardiomyopathies. Kids with kidney abnormalities, that also can put the heart at risk for certain cardiomyopathies. And along with, nearly every pediatric specialty, there are conditions that impact both the heart as well as some other organ systems. So we're always working very collaboratively with the other groups.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about pediatric heart health with my guest, Dr. Elizabeth Mitchell, a pediatric cardiologist with Cohen Children's Medical Center at Northwell. So, Dr. Mitchell, another question that I have for you. I know that you deal with a lot of individual pediatric patients. Can you describe one memorable case that you've worked with in your career?
Oh, I can think of a bunch. Probably one of the ones that stick out more recently is the case of an arrhythmia that was picked up during fetal life. And I followed the mom very, very closely during the rest of her pregnancy, giving mom medicine to help control the arrhythmia. And after the baby was born, other heart related issues came up. So between myself and the electrophysiology team, they're the ones who deal with the arrhythmias, and our surgeons, we've all worked very closely together and with this family, taking care of this child's heart for multiple different reasons. And it obviously is just so scary for a parent to be dealing with this, both when they're pregnant and they know that something is wrong with the baby's heart in utero, or after the baby's born. This one particular child, because of the same kind of condition that caused the arrhythmia, also caused some heart damage, so had to have a valve repaired at about 9 months of life. Wow. So it's been a long journey, and it's wonderful to see. I just saw her last week, and she is just this adorable little girl that you would never know is dealing with any of this. So it's wonderful to see them grow up and get well. And
I'm sure there's a bond between the physician and the parents when you do see the child in utero and then the child to be born and still being cared for. The same doctor is very, very touching. And it's exciting for you seeing the child come and being born and now still treating the child. So you'll treat that child up until the age of 18?
Yeah, probably 18 to 20, and then off to our adult congenital specialist.
Wow, they're going to have a hard time leaving you. Okay, so now treating a child with a heart condition is something that's very, very I guess it's very near and dear to a lot of people, because this is a very organ that affects everything else, right? Yeah. So what advice would you give parents who are concerned about their child's heart health?
I think, especially for the younger babies and children, the first step comes with the pediatrician. And any pediatrician has listened to many, 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 many hearts. So they are kind of the first line at determining if there's anything concerning with the heart. And if the pediatrician ever does come across anything concerning with the heart, then we are here to further evaluate and care for both the child and the family if there is something. And besides that, leading a healthy lifestyle of good eating habits and exercise, so that my adult cardiology colleagues, don't end up having to see you as well. Yeah. So even while women are pregnant, you're telling them how to eat, take the folic acid and all of that, multivitamins. Or is that important? The OB is typically telling them the specific vitamins that are needed and what they need for pregnancy. I would say probably more so when they get to be a little bit older, do I give my patients advice on healthy eating habits and exercise and such. What would you recommend in terms of resources for families? I think if a family ever comes across or is told by their pediatrician that, say, a heart murmur is heard or there's something else concerning with the heart, I think general resources like the American Heart Association and American College of Cardiology, those are great places just to learn more information, say before the visit with the cardiologist. Something I say to my patients all the time is that I'm a realist and I know that everyone is going to look online. So if I've told them that they have a heart condition or something related to the heart, I know that they're going to go look online, and that's just the reality of the time that we live in. I think sources like the American Heart Association or American College of Cardiology are good ones to give general information and to help almost define some of the terms that we use. I'm always writing things down for families. I'm always writing down the terms, putting things in diagrams, because medicine is a whole other language
it's complicated.
Especially for people with heart conditions, they have to learn this whole other language. So it's important to use resources that are almost generic like that, just simply to become more familiar with the heart and how it functions and what all the terms that we're talking about mean. But I think on the flip side, kind of looking at generalized health for children and heart health, really starting from the childhood years to prevent the heart disease that we see in adults by, eating healthy and exercising and getting children involved in physical activities, not necessarily sports. There's lots of different things that kids can do, but physical activities and healthy eating.
How do we find you?
The easiest way is to Google Cohen Children's or Northwell Pediatric Cardiology, and you'll see our whole practice right there.
Well, thank you so much for being here, Dr. Elizabeth Mitchell, a pediatric cardiologist with Cohen Children's Medical Center at Northwell Health. We appreciate all of this information. We hope you stay healthy and continue to do the great work for all of our amazing first responders who certainly are heroes, and for you who treat our babies and our children. Thank you so much. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.